I think the work of IAHPC is so important because nobody else does it. So you need somebody who's really concerned that everybody gets access to good care.
The gap has widened, and the ones in the high-income countries are the ones that are getting the best access to care.
So there's an enormous inequality, an enormous disparity in access to palliative care and pain control between rich and poor countries.
We have done great strides and wonderful improvements in high-income countries, but we have failed to bring those resources and enabling the individuals working in the low and middle-income countries to the same degree.
Palliative care and pain control are not readily available in the developing world, and the mission of IAHPC is to change that.
So in children's palliative care, we know that there's about 21.6 million children globally who need palliative care, and yet people don't know about the problem.
It's focused on relieving suffering, and that's the underlying theme.
Practitioners and providers need controlled medicines in order to do palliative care, such as morphine, and they're unavailable in more than 75% of the world.
It is frustrating and heartbreaking to see patients suffering because of the unavailability of a simple cheap drug like morphine.
And I wonder if Jose wasn't feeling that sense of inferiority because he is not curable. And I wonder if the system is set up in ways to make this happen. Now, another quote from Dr. Martin Luther King says, we have a moral obligation to disobey unjust laws. And I wonder if we don't have a moral obligation to challenge unjust systems, stand up to these systems.
I think IAHPC has been extraordinarily inventive over many years to try to find any way to change things.
We go along with these big regional congresses and support the regional associations by bringing in people who otherwise couldn't come because they don't have the funds.
I think the best way to improve palliative care in the world, and mainly in developing countries, is through education.
For us, it's very important to have more knowledges and communication with others. It strengthens us.
I have been able to disseminate the knowledge, disseminate information regarding IAHPC to other colleagues.
I know so many people who would have loved to come but couldn't come because they didn't have the means to make it here. So I'd like to say thank you so much and pray that that continues going on and on.